Medurstand. Understanding Medicine.
Professor Aziz Rehman again from Medurstand, and in my last video we covered how to assess central venous pressure, and I also described some physics behind this, but in this case we are going to concentrate the waveform. You know, first of all you have to have this angle and the area well lit, well exposed. First of all, you need to appreciate that we have two types of waves. One is carotid pulsation, the other is jugular venous pulsation. So you need to be able to differentiate between the two. And one very reliable method is that carotid pulsation is palpable, whereas venous pulsation is not palpable. So if you see a pulse and you can feel it with your thumb, that means it is carotid. Venous pulse in a normal person cannot be palpable. Maybe in some extreme situation, in some cases it may be palpable, but mostly it is not. And the second thing is that carotid pulse consists of one single expansile movement, whereas venous pulse consists of three different waveforms: A wave, followed by C wave, followed by V wave. There are three small follicle-like waves. So if you can see one single full expansile pulse, that is likely to be carotid. If it consists of like filtered, like 2 or 3, and that is likely to be venous. Carotid the pulse does not have an upper level because it goes beyond the jaw, whereas venous pulse has got an upper level, which may change with breathing. So that said, now I'm going to tell you the various abnormalities of venous pulse. You know, normal venous pulse consists of A wave. A wave is caused by contraction of the right atrium. When right atrium contracts, it of course generates some pressure, and that pressure pushes blood from the right atrium to the right ventricle, but also some pressure goes back and transforms into A wave. So that is A wave. And it is followed by an X descent, because after the contraction the pressure in the aorta will reduce, and during that phase there will be right ventricular contraction, and because of right ventricular pressure contraction, the tricuspid valve will move slightly toward the right atrium and will increase the pressure in the right atrium. Pressure in the right atrium is decreasing actually due to X descent, but during its descent there may be slight wave, and that is caused by right ventricular contraction, and it coincides with the ventricular systole. X descent then continues, and once the right atrium is completely empty, then it will start filling up because of continuous venous return. Because of continuous venous turn, there is another waveform that is called V wave, and V wave indicates right atrial filling because of continuous venous turn, which is followed by a Y descent. So this is the normal waveform. Normally you just see these flickers, you can hardly appreciate, but there are certain conditions where you could have these, there's some abnormality. For example, the A wave become bigger than normal, can become cannon wave. Now you can imagine if there is a case of tricuspid stenosis, there would be, when the right atrium contract, it would contract against a pressure, so A wave becomes bigger. But in real life that usually does not happen, because most patients with tricuspid stenosis, they go into atrial fibrillation. So, but in conditions like complete heart block, you know, in a normal person there is atrial contraction which is always followed by ventricular contraction. Atrial and ventricular contraction, they never occur at the same time in a normal sinus rhythm, right? But in cases of complete AV block, because there are two different rhythms, one for atrium, which is beating at the rate of 72, 75, 80 beats per minute, and then there is a separate pacemaker for the ventricle, which has got a slow rate. But both have different rates. So there is a possibility, because both are different rhythms, there is a possibility that when right atrium contracts, The tricuspid valve is closed because of a ventricular systole, right? So if that happens, all the pressure generated by right atrial contraction will be transmitted back and there will be a huge A wave. And that will occur intermittently. That will occur intermittently, so randomly when you're examining constantly for several seconds, maybe more than a minute, then one occasional A wave will be bigger than normal. That is called cannon wave. This is feature of complete heart block, AV nodal block. Then there is another abnormality called ventriculization of neck veins, and that is when this small C wave can become huge. Normally, when right ventricle contracts, tricuspid valve does not allow blood to go back to the right atrium. Right ventricle contraction pushes tricuspid valve into the right atrium a bit, but there is no actual movement of blood from right ventricle to the right atrium. But if there is tricuspid regurgitation, right ventricular contraction will generate a lot of pressure and much of it will go back from the right ventricle to the right atrium and then onward to the neck veins. So all the pulsation, the C wave can become visible and sometimes palpable. This is also called ventriculization of neck veins because this is actually the pulse which is generated by the ventricular contraction. In this case, actually C wave and V wave become one huge vein, a wave which is the indicator of tricuspid regurgitation. So these two I think important abnormalities. In atrial fibrillation, A wave will disappear, and one more important thing is sometimes we see grossly engorged veins, sometimes up to the angle of jaw, but we don't see any pulsations at all, right? So this is another important condition. If you see engorged neck veins without any pulsation, this could represent some obstruction to the jugular vein, and there would be some superior vena cava obstruction, there may be mediastinal tumor or there may be some massive pericardial effusion, pericardial tamponade. So in all these conditions, neck veins will be engorged, but there will be no pulsations. So I hope that gives you some idea how to examine neck veins and how to make a diagnosis based on abnormalities in the neck veins pulsation. Thank you.